And welcome to my YouTube channel, Dr. Winnie the Pharmacist, Pidgin English version. I also get Dr. Winnie the Pharmacist for English version. So if una no understand what I dey talk well for here, una fit switch go the English version. This Pidgin English version now for people wey not too sabi baby grammar, maybe for the break and down, because health now for all. By opening this channel and they talk about this health matter for Pidgin English, we want help achieve universal health coverage for all, because health na human rights. So I also get this channel for English version. Wanna help spread the message. My name na Dr. Winnie. I be board certified pharmacist. It means say I be registered pharmacist. I also be practicing herbalist too. I dey practice herbalism. I dey take herbs and natural things dey cure disease. I believe in nature, and nature they do plenty better thing for human being. In fact, I go soon dey drop DIY videos and different ways to take make herbs for small or common ailments wey person fit treat, so that person go fit improve in life. So now welcome to this channel. This channel na Dr. Winnie the Pharmacist. And as una don't see from the topic today, wetin we go dey talk about be the different kind of havoc wey worm fit wreak for person body. May I break them down again? Wetin I mean by that English when I just talk now be say worm fit cause complication, worm fit cause plenty wahala for person body. Worm even fit kill. People they underrate worm, but worm no be wetin person suppose underrate. Worm na common thing. They sound common, but that common thing wey dem dey call worm, or parasitic worm, or intestinal worm, or stomach worm, e fit cause plenty wahala. And so today wetin I go dey talk about, I go dey explain the different kind worm, how to avoid them, how to take tackle am, and I go dey tell you wetin each worm fit do. If I see say the video go long, I fit break am into part 1 and part 2. But if una listen to this video from the beginning to the end, una go understand am well. Una go know the mechanism by which worm take the cause problem and how to avoid them, and so many better things I go to talk for this video. So without waste of much time, we'll quickly dive into the main topic of the day. Thank you. So wetin be intestinal worm? Intestinal worm, as the name imply, na worm wey dey live for inside intestine or the stomach of human being. Intestinal worm na also parasitic worm. Wetin be parasite? Because parasitic e come from the word parasite. Parasites na living thing wey dey live for inside another living thing. But this time around, these parasites na only him dey benefit. The thing where they live inside, what we dey call hosts. The living thing where they call parasites, where they live for another living thing. The another living thing when I talk about, another name na hosts, while the parasites na the one where they live for inside the living thing. They no invite them, we just call chook himself there by fire by force. Now, for this kind relationship or this kind living, now let the parasites the benefits. How the parasite take the benefits? He go they chop on top of that living thing. That's by way of either he go they suck the blood of the living thing, or he go they derive or achieve or get nutrition or food from that host. I hope say this explanation makes sense. Now, of course, if something they suck person blood, no be winch be that. So another name for me, but even man, even they make am look nice, they call am parasite. Me I go say na winch be that o. How something go dey suck your blood, you understand? So worm na wetin they do be that, they go dey suck person blood. The person chop food, then go chop am. You chop food, say you dey hungry, or say make you no dey hungry again, then the worm wey dey inside your body go chop the food. Imagine, worm no work o, he just dey sit down. You chop food, as the food just dey land inside the stomach, the one to come clear am go. Na parasite, na winch. Na the no long story, na winch be that. So for life, funny enough, e get friends too wey dey behave like worm. In fact, na parasites dem be. This one na by the way o, if you know say you get friend wey dey behave like worm, wey him behavior resemble parasite, in fact wey be parasite, may just cut am off. You fit come to pharmacy, ask them as dem get drug for worm. I know say dem go kuku get drugs for parasitic friends. Anyway, that one na by the way. So may we continue the story. Worms na one of the main type of parasites wey dey affect human being. That's the intestinal worms or stomach worms. Intestinal worms or stomach worms dey very common or more common for tropical and subtropical regions of the world, but sometimes you fit find am for United States of America. Most of the time, intestinal worm dey cause mild illness or mild sickness, and person fit treat these kind illnesses with medicine. Now we look the common signs and symptoms wey person fit get if he carry intestinal worms for body, or if worm dey for inside him stomach. So e get different signs and symptoms, namely abdominal pain, diarrhea. Diarrhea na the same thing as running stomach. That's person go to use toilet or bathroom, and the stool or the shit wey go dey comot, e go dey very watery. Often if you just go use bathroom now, if you comot, go come dey worry you again, and the thing wey you go dey comot your body na watery stool. Now that one dem dey call diarrhea. Then nausea, that's person go dey feel like say he wan vomit. Then vomiting, person go vomit, actually go throw away comot for mouth. All na worm dey cause am. Then gas and bloating, plenty gas for belle. You go see say e go just dey mess too much. Sometimes if it dey mess for through anus of your bum or if it mess through mouth. And bloating, you know, you go dey hear sound for inside stomach, then person go dey pass out, wetin they call mess. Then fatigue or tiredness, person go just dey feel tired. Of course, if person get wetin dey suck in blood every time, or if person chop something, go chop the food back, so they feel tired now, so they get fatigue. Then also unexplained weight loss. Wetin I mean by this one be say person go just dey lose weight anyhow, wey person no plan for. No be say you wan lose weight or you too fat, you go just see say you go just dey lean dey go. No be anything, no be juju be that, na worm dey cause am. Then abdominal tenderness, that's the abdomen or the stomach go dey tender and soft. Then dysentery na the same thing as diarrhea, but this time blood go dey inside. And mucus na one kind slimy substance wey dey draw, dey like catarrh wey dey comot for nose. Then the blood, sometimes this blood fit dey inside stool, because worms dey bite belle. So they dey bite belle now, the place where dem bite go bleed, blood go comot, so go mix with the stool. So that's na why person dey get dysentery. That's blood and that mucus or catarrh wey dey inside person's stool or shit. Worm also fit cause rashes and itching for the rectum or anal area. E also fit cause rashes or itching for the vulva. Vulva na the external genitalia, that's the external part of woman vagina. So no be every time wey person dey get rashes and with that place dey scratch person na say na toilet infection or STI, that is sexually transmitted disease, dey cause am. No, sometimes e fit be worm. Go see say person bum or nyash or vagina just dey itch, dey scratch, rashes dey comot, you understand? So you see say worm fit cause plenty thing. Person go come dey think another thing, meanwhile na worm dey cause am. Sometimes sef person fit come dey treat something else, meanwhile na common worm. Well, I don tell una, especially the first time when I talk for my intro video, say nothing dey common. You know say something fit dey common for my eye, but no mean say e really dey common, because na common thing sef fit kill person sharp. In some cases, worm fit comot for inside person's stool or shit if person go use bathroom or toilet or restroom. You know, all na sign of worm be that. Another thing wey fit happen be say if worm don tey for inside person body and don mature well, na round worm dey usually do that kind thing. E go move up into the lungs, hey, go even dey chop the lungs. Worm na bad thing o. So e go move up into the lungs, go dey find way to comot. And most at times, na make I say worm na winch o. Na for night that thing dey usually happen. If person dey sleep, just open mouth, next thing be say go vomit that worm, or that worm go just crawl out from the mouth, comot long something like this. So all na signs and symptoms of worm. Some people fit dey many years with worm go dey inside their belle or inside their intestine, and they no go get sign or symptom. You get people wey dey like that. Those kind people, then they call them asymptomatic. Anytime when you hear the word asymptomatic, it means say person no dey show sign, but no mean say person no get am. Person get am, but in dey asymptomatic, meaning say e no dey show the sign. And such people na the dangerous kind people be that, because dem go dey share am for people, because I know they show sign now say they get, but they go dey infect other people through their stool. Maybe say if anything contaminate with their stool, or as we dey progress, you go see say different worm dey comot different places for body. Some worms sometimes if they mature, if they wan lay egg, they'll comot for person yansh come lay egg. You know, take for instance now, that kind person lie down for bed, if he comot lay egg, maybe some deposits for on top of bed, then you can't carry yourself sit down, the thing go come, you know, follow body come your own, then start that kind thing. So now so the thing take be. May we look how to sabi say worm dey inside person's stool or shit. If worm dey inside person belle, e go eventually pass through person digestive system, come go comot through the shit when person shit, or when person go use bathroom or toilet. So person go dey see worm for inside him stool. Sometimes person no go fit see all these signs and symptoms of worms wey I don talk before, but person fit see worm for inside him stool. In fact, different kind worm fit comot for person shit or for person stool. Shit, if una hear me dey call stool na the same thing as shit. For round worm, person fit see pieces for inside him stool, or the one wey dey alive wey dey move up and down for inside the stool. I don already talk say person fit vomit big round worm, or big round worm wey don mature fit comot from person mouth also. For pinworm, person fit see small worm wey dey like white thread for inside him stool. You know say worm dey like night things, na make people dey talk say worm na winch. Sometimes person fit see pinworm wey dey the length of staple, you know stapling pin now, for around the anus at night. Usually when the female pinworm wan lay egg, na for night e dey take comot for person anus, come lay im egg around the surrounding skin of the anus. Okay. To diagnose worm or to detect worm, doctor fit take sample of persons too, go analyze am or check am to confirm say person get worm. Common types of worm wey fit infect or affect human being be: 1. Flatworm, including tapeworm and flukes. 2. Roundworm. Another name for roundworm na Ascaris lumbricoids. Na the scientific name be that. So if you hear doctor dey talk say person get ascariasis, know say im get infection of roundworms. The third one na pinworm. Another type of worm wey fit affect humans na hookworm. I know say many people don hear about hookworm, so we go look into the matter of these worms when I don call one after the other. Oh, first look tapeworm. Human beings dey contract or dey get tapeworm when they chop raw or uncooked pork or beef. That is beef or pork where they never cook well or where they raw. Wetin be pork? Pork na pig meat and beef na cow meat. So na don carry ear hear am for una wey like pork well. No say pork na very dirty animal. Then of course cattle or beef or cow wey dey Africa, no say dem no dey too check am well. Then they roam about, they chop grass here and there for inside bush. I know say for Africa people too dey go shit for inside bush, so cow fit come chop grass wey dey contaminated with feces wey don carry tapeworm, and then e go chop plus the tapeworm, especially the eggs. Then when the eggs enter inside the cow stomach now, then go come hatch, come grow, mature. You know say some of these worms then get stages. Like tapeworm, I know say tapeworm, e go grow for inside pig or for inside cow, then go reach one stage, come hibernate, come dey wait make cow shit am out or make person chop the tapeworm through the meat. Then when e enter inside person stomach, e go come grow fully. All this kind something where dem dey call worm, but true the best name na winch. The scientific name for tapeworm na taenia or taenia, anyhow wey una fit call am. The spelling na Taenia. Make I spell am again. Taenia. So e get different type of taenia. E get the one wey dey for inside beef, then they call am beef tapeworm or Taenia saginata. If una wan see the spelling, go dey for up the screen. I go dey spell am as we dey go. Then for pork tapeworm, then they call am Taenia or Taenia solium. We also get Asian tapeworm, then they call am Taenia or Taenia asiatica. Scientists or people don find tapeworm wey grow as long as 25 meters. You know as 25 meters fit long reach for inside human being. So tapeworm fit grow to that length for inside human being. Kai, imagine say tapeworm wey dey long up to 25 meters dey inside human being. The kind havoc wey that thing go wreak. The next type of worm wey we go dey look be fluke. Fluke, F-L-U-K-E. So we get different types of fluke or flukes or flukeworm. Up to 70 species dey available. Flukes dey live for inside human being intestine, and their size range from a fraction of an inch to several inches long. Human beings fit dey infected with fluke if dem drink water or chop food wey dey contaminated with fluke worms. Flukes dey very common for Eastern and Southeast Asia. The next worm wey we go look be pinworms. WHO estimates say over 1 billion people live with pinworm. So over 1 billion people get pinworm. Pinworm dey more common for North America. So you see, people dey talk say Americans or Igbo people no get worm, na lie o. You see say pinworm dey common for North America. So everybody get their own. Africa we get our own, America too get their own, Asia get their own. So everybody gets. So no dey feel that kind thing say na only Africa. No, anybody fit get. In fact, I believe if care is not taken sef, Igbo people fit get worm pass us. No be me talk am o. In fact, I wan make una know say pinworm fit cause appendicitis. Una know wetin be appendicitis now? Appendix na one tube-like end, worm-like end of the rectum. For people wey sabi biology, rectum na part of the large intestine. So the end na wetin they call appendix. Now that appendix, if e dey inflamed or something enter am like food particle, or this pinworm sef, this worm dem fit fall inside, you know, it will come block am, and if e block am, it will come dey cause pain. When pain dey for inside part of body, dem go say that place dey inflamed, because pain come with different types of symptoms like redness, swelling, you know, pain now. So that place go dey inflamed. And if person get appendicitis, the only cure na to do operation, that is surgery, cut the belle open, then come comot that place and cut am off, so that person go get in peace. Because if appendix bursts, inflamed appendix burst for inside person belle, na die be that o, because e go burst with all the unwanted something, like the different bacteria go burst, spread am for inside belle, the person go get infection. Na wetin dey kill for appendix be that. So you see say worm fit cause appendix. Common worm fit make dem go operate person. In fact, I don even see one video wey be say the worm dey plenty for inside the person belle and intestine, different places. Medicine no go fit do too much. Na operation dem do that person, come dey cut up all those internal organs, dey comot the worm. If you see that video, dey very irritating. So na the thing wey make me say make I do this video, so that we fit avoid and we fit nip am at the bud. Wetin I mean by nip am at the bud be say, as e don start small you fit kill am, clear am out from the body, so that e no go come cause complication and dangerous wahala. The next worm wey we go look at na hookworm. Most people wey get hookworm, dem no dey get symptom, so dem dey asymptomatic. That's most people. E no mean say na everybody wey get hookworm no go get symptom o, because hookworm dem dey usually dey, most times dem dey like dey for around the lungs or heart. Dem go come dey pinch, dem hook, as the name imply, without their hook, or just a hook person, dey pinch, dey fight person very hard, very wicked things like that. And as dem dey pinch person go dey feel like say dey hook im heart, dey hooked, like say person take something hook im heart wan comot am, or hook im chest, or hook im lungs wan comot am. If una get well, una don ever draw water from well, you know say sometimes if you dey draw water from well, then maybe say that your container or that your, for outside then they call am guga, if you fall inside well, of course you go wan comot am, so you go get something where then they call kura, like hook, go get hook like this. Now so hook dey dey, so if you throw away that kura inside the well with the rope, then go fit search for your container or your guga inside well, then the kura go hook am, then go fit pull out the container. Hookworm too come dey like that, like say dem throw away hook for inside person chest or heart or lungs, the thing go just hook person, like say you know they wan comot the heart out. Na so way people wey dey get hookworm dey usually feel pains here and there, you know, due to the biting and the hooking wey the hookworm dey hook. In fact, the ojujukoro name for worm suppose be winch. So I don talk am say hookworm dey pinch for chest and the thoracic area, and e dey cause severe pain. Now make I tell una something. Before, hookworm dey very common for United States of America, especially the eastern parts, but now e don dey very reduced. Why? Na because living standards don improve well. So with improved living standards, person fit reduce hookworm. Let's say now if health personnel come dey serious, especially these environmental health workers, come dey check meats wey dem dey kill or dem dey slaughter for abattoir, dey check am whether e pass or e meet standard. You know, if people wey dey take care of these animals wey dem dey kill and sell to human being to chop, animals like cow and pig, you take care of am well well, give them clean food, no let them go dey expose, dey chop anyhow thing wey don contaminate finish, and so on and so forth. We go fit curb or curtail or reduce these health hazards wey dey happen as a result of contaminated meat and co. The next worm wey we go look be roundworm. I don tell una before say another name for roundworm na Ascaris lumbricoids. Look am for the screen, the spelling dey the screen. Ascaris lumbricoids, very easy to pronounce. Ascaris lumbricoids or roundworm dey cause ascariasis. Now ascariasis be the infection, as I don talk, wey Ascaris lumbricoids dey cause. So make I tell una one tori. Una know say ascariasis, over 800 million people for this world dey infected with Ascaris lumbricoids, or they get ascariasis. Ascariasis dey rare for United States of America, but some few number dey their southeast or eastern side. However, ascariasis dey very common for Africa, especially Nigeria. Person fit dey infected by Ascaris lumbricoids or roundworms through drinking of contaminated water or eating contaminated food, that is food wey get roundworm or their eggs or even water. And adult roundworm or Ascaris lumbricoids fit grow up to 1 foot long. That na serious matter o. And most times person wey get roundworm no dey get symptoms most times o. The fact be say person fit no get symptom at some points for a very long time, then sometimes when symptom wan occur, e go just happen bam. Like now, person fit get roundworm for inside body for a very long time, symptom no go show, but just one day person go come dey get diarrhea, go just see say e go get running stomach. And you see, na the reason why I tell una say worm fit kill. You know say untreated diarrhea, so you just dey get running stomach, think say na joke, go just dey go see go soon stop. Meanwhile, if person dey get running stomach, e dey lose water, they lose important minerals and salts through that running stomach. And once person lose those salt and water, e go get wetin dem dey call electrolyte imbalance. Now this electrolyte imbalance for body fit kill sharp. Na the thing wey dey kill when person get running stomach or diarrhea. Then dysentery, know say even blood go dey inside, you understand. Now person dey also lose blood, and then even mucus mean say due to the way the worm take dey bite some places now, so all those slimy substances wey dey protect those mucus go mix up with the stool, come dey comot. So you see, if person get running stomach and e no quick treat am, go fit die. And wetin cause the running stomach na worm. Simple worm, common worm. Now make I say worm no common. In fact, worm na witch, because witch dey suck blood. And wetin worm dey do? Worm dey kukuma suck blood. So all of them na the same gongoro dey carry them. When we look wetin dey cause intestinal or stomach worm, or wetin dey cause make person fit contract parasitic worm. Number one, if person chop undercooked meat, e mean say the meat never done well, so e still dey raw. In other words, from infected or contaminated beef or pork or fish. I don tell una before say pork na pig meat, beef na cow meat, then fish too, because dem get fish tapeworm also. So if person no cook him meat well, make it done well under high temperature, so that those worms wey dey inside go die, because those worms dem get very strong body, and their egg no dey quick die like that. Na adaptation dem dey call that one. Dem dey adapted. Nothing wey wan die now. Even you wey dey watch me now, even me wey dey talk, I no wan die. So the worm no kuku wan die. Worm kukuma dey look for how e go take survive. So the body dey normally dey very thick and strong. Before e go die, e need very high heat. So if person no cook the meat well, sometimes you go chop meat, the meat go still strong. Dey careful, that kind meat fit infect somebody with worm, and I don't see wetin worm fit cause. Of course, so if you eat undercooked meat or undercooked food, mean say e dey invite winch in the form of worm into your body. 2, eating of contaminated vegetable, especially all these vegetables where dem plant close to sewage or shit. Say human feces or even contaminated feces of animals. Feces, that is shit, na very good manure. E dey help vegetables to grow. So that kind of vegetable now, e go grow and e go dey very attractive for eye. Go grow, e go dey green, go dey fresh, because the vegetable kuku see enough nutrients wey e go carry take grow. But if you buy that kind of vegetable from market, make sure say you wash am very well and you cook am. E good not to cook vegetable too much, but also no be say because no cook am too much, then no go allow am make e done, then you come carry worm come dey chop. So make una dey careful also, because contaminated vegetable fit give person worm. Consumption or drinking of contaminated water. That na why Africa get worm plenty, because most of our water dey contaminated. Many people never get pump water, or wetin they call am sef, water, pump water, make I just talk am like that. Many people no get access to pump water. So most people, especially for rural area, then they go stream, they fetch water. This same stream where then they shit for inside, then they bath for inside. Some people still they drink that kind of water. Oh, May God have mercy on us. Sometimes safe, some people fit get, like for inside their house now, the sewage or the soak away, they very close, not too dey far away from the well where they supply water to their house. E no good like that, because with time that sewage or that shit from the soak away fit seep, fit find im way small small into the well. So if person dey build house, make e take cognizance, I don speak big grammar now, make e take note of the place where im go locate in soak away and the place where im go build im well. Una dey hear me so? Consumption of contaminated soil. Sometimes if person no wash im food very well and contaminated soil dey inside, like say where you dey cook, like vegetables and so on, even meat or anything, person go fit contract or get worm. Poor sanitation and poor hygiene. That one I no go too talk am now. Everybody know wetin be sanitation. So person suppose dey clean. If you dey practice proper hygiene, sweep everywhere, clean, disinfect places, put things like Dettol, bleach, clean places, so that even if something fall for ground, like let's say for your kitchens, if your kitchen dey clean, the ground dey disinfected, even if you dey cook and e fall for ground and you carry am rinse am well well, e no go dey contaminated. You know that kind thing. Cleanliness, they say, is next to godliness, so make we dey practice am. So if person chop any contaminated thing, like e chop contaminated food wey dey contaminated with worms, or drink contaminated water, the worms or the egg of the worm go pass in from the mouth down into the intestine. Then if na worm, e go stay there, come dey grow, come mature, come lay another egg again, come reproduce for inside person stomach. If na the egg go hatch and go hatch out the worm. The same worm go still grow, then go come mature, they'll come mate for inside person stomach. All this thing dey happen, they'll come reproduce, come born their own type. So at this stage, person fit no get symptom, but when they come dey do like that over and over again, come dey grow, dey mature, dey give birth, soon they will come dey plenty. You know say if one worm dey suck blood, e dey different than when 10 or 20 or 100 at a time dey suck blood. You know say that person blood go finish now. Na im make with time person go come dey lean. So now when they come pack plenty, dey plenty, and then they suck the blood all at once, and then they do other things for inside person body. Now when person go come dey see those symptoms when I don't talk about. When we look risk factors for intestinal worms, children dey particularly susceptible to intestinal worms. Wetin I mean be say children fit contract intestinal worm sharp sharp. The reason be say, you know say children dey always play on the ground. They like to play for ground, whether na Oyibo pikin or na African pikin, all of them are the same. And then they easily put hand for inside mouth. They go touch ground, touch this, touch that one, put am for inside mouth. Older adults too fit contract worm well because their immune system dey weak. According to WHO, 24% of the entire world population dey infected with soil transmitted worm. That's a very big number. Worm infection dey more common for the tropical and subtropical regions of the world, especially sub-Saharan Africa. E also dey common for the Americas, East Asia and China. People where they live for or where they visit developing countries, they at higher risk of contracting worms due to decreased sanitation levels where they did those kind places and drinking water from contaminated sources. When we look the possible complications of worms for body, intestinal worms fit increase the risk of malnutrition, anemia, and intestinal blockages. It means say different parts of the intestine fit block due to worms. That is, the worms go fit pack for inside one part of the intestine, go pack again, block one side of the intestine, go pray when they don't plenty for body. That one na only surgery dey comot that kind. Yes, person fit get malnutrition now. Why? As person dey chop food, the worm dey chop am back. So the nutrients wey person suppose get, the worm dey suck the nutrients dey go. Instead of the nutrients to enter person body, na the worm go dey benefit. So person go dey chop, dey feed worm. Imagine say you go dey work hard all your life, you get money, you come chop food, then worm come say thank you, chop all of them back. Now why person wey get worm dey lose weight now? Because of malnutrition. Also, anemia due to loss of blood. Now loss of blood now make I say worm na winch. In fact, we dey look for winch. People no know say dem carry winch. They go bind winch. I bind you, I cast you, I bind you, I cast you. Meanwhile, you get the one where they suppose start with for inside belle. Complications of worm fit occur or dey higher for people wey get low immunity. For older adults, I don't talk say older adults fit get higher risk due to low immunity. Even sef people with HIV, because they get low immunity also. Intestinal worms also fit pose risk for people wey get belle. That is, people wey dey pregnant. Why people wey dey pregnant dey at higher risk if dem get worm be say dem no fit just take any drug so that worm go comot from their body and stop to dey give them problem, because dem get belle. And the person get belle, you know, fit just take any drug, because the drug fit affect the baby wey dey inside belle. So you see, double wahala for dead body. So for this worm matter, when e go dey necessary, make we see when e go dey necessary to go see doctor if person get worm. Number one, if person suspect say e get worm infection, make we go see doctor so that e go fit run tests, or even go see pharmacist or your healthcare provider. You understand? I want make una know say medicine or medication dey very effective to clear these worms most of the time, especially if person start to dey treat am at the early stage. If you just notice am at that early stage before it go come cause different complications like appendix and blocking of different parts of the intestine, medicine fit clear worm sharp comot all this rubbish witches and wizards for body. If you dey see blood or pus inside your stool, quick run go see doctor or your healthcare provider or your pharmacist. If person dey vomit frequently or daily, run go see your healthcare provider or your doctor or your pharmacist. If person gets elevated or high body temperature, make e run go see im healthcare provider. Also, if person dey extremely tired or fatigued or dehydrated, that means say water no dey person body, quick go see your healthcare provider or your doctor. If person kuku dey lose weight for no reason, you just see say you just dey lose weight, you just dey lean dey go, run go see your healthcare provider or your doctor or your pharmacist. If person dey feel sick, e dey get diarrhea, make quick run, no waste time, because that thing fit kill. See your healthcare provider. Also, if person dey get stomach pain almost all the time for long, go even reach like 2 weeks, but wetin you go dey wait for like to reach 2 weeks sef? Me, if I just dey get small any ailments like that, I will just knack am immediately, because I don tell una say human being no be anything. Why you go even wait for 2 weeks? 2 weeks too long now for something wey wan kill person to finish am. If person gets red and itching rashes for skin wey dey shaped like worm, the rash go dey red and e go dey scratch person. That's wetin I mean by itch for on top of skin. Sometimes the shape go come dey like worm. Abeg, run quick go see your healthcare provider. How dem dey take diagnose intestinal worm? Na how doctor dey take check say person get intestinal worm, or how your healthcare provider dey check say you get intestinal worm? Make we look at. Doctor fit check person stool. So most times if person is suspecting get intestinal worm and he meets doctor will tell am say make he bring his stool sample. That means say if person go to use bathroom or toilet, he will just comot small, scoop am for inside container. Most times dem go fit give am sterile bottle or even just container. Go scoop am go give doctor so that doctor go fit check am. Dem go fit examine am for under microscope to check for the worm. Sometimes doctor go fit request for several stool sample to take check or diagnose to confirm say person get worm. Another test wey dem fit use to diagnose or to check for worm, dem dey call am Scotch tape test. Look the spelling for your screen. This Scotch tape test involve say dem go apply tape to the anus several times so that dem go fit retrieve or collect egg of pinworm. You know say I don tell una say pinworm na for anus dem dey comot go lay egg when dem mature. Na wetin dey cause say person bum or person anus or person nyash go dey scratch am. Worm. So if dem carry that tape several times, tape that bum, tape am dey comot am, tape am dey comot am, dem go carry am go look under microscope to check whether pinworm dey. Use the microscope to check for the eggs and so on. If dem no still fit see the worm, the doctor or the healthcare provider fit run blood tests. That blood test, wetin dem dey check for na the antibodies wey the person body fit produce if person get worm. Na only if person get worm na im person dey fit produce those kind antibodies. Na im make dem go tell person say make he bring him blood so that dem go check am. Na only some parasites na im dem dey fit detect with blood. Doctor also fit take person x-ray or do imaging tests. Examples of those imaging tests wey doctor fit do to detect worm be CT and MRI. Wetin be CT? CT na computed tomography, while MRI na magnetic resonance imaging. Doctor fit carry out this CT and MRI depending on the location of the condition wey him dey suspect. Now, the last thing wey I go drop for here before I end this video be say if person don get all those previous signs when I don mention before for inside this video, or just recently travel to developing country, e go good make person quick book appointment with a healthcare provider or a doctor to check whether he get worm. Now I go stop this video for here, so make this video be the part 1 of this worm discussion so that the video no go too dey long. For part 2 of this video, I go dey talk how person fit take treat these worms and how person fit prevent these worms also. No say na so dem dey do for Nollywood movies, so make me too I do my own. With this, I don't come to the end of this video. The only thing wey I go dey appeal to una as usual be say una like this video well. If una feel say the thing when I talk don enligh ten una, don open una eye about worms. Abeg make una like this video well well, make una share am so that other people wey no sabi go sabi. Make una like am so that YouTube go dey recommend am to other people too wey need am. And make una comment, put una comment down for comment section, and abeg make una subscribe now. E no hard, make una just hit that subscribe button wey dey show for una screen there, and also hit the bell notification, that black thing wey dey like bell, so that anytime when I drop video e go drop for una go sabi say I don drop new video. Thank you very much, and I don dey sign out. God bless you. Thank you for watching. Till I come una way next time. Bye bye.